Have you ever wondered what drives the wound healing process forward? The normal wound healing process is a complex interaction between different cells and molecules in the wound bed. But one essential aspect of normal healing that is seldom discussed but has been known about for over a century is the current of injury. This current of injury is a form of bioelectricity caused by the leakage of positively charged ions, such as sodium and potassium, across the damaged epithelium. It generates around 140 millivolts per millimeter in a healthy individual. Scientists have shown that many of the processes in wound healing rely on this current of injury and the bioelectrical signaling associated with it. Processes like cell proliferation, cell migration, and cell differentiation are all reliant on tiny bioelectrical signals. Cell migration even happens in the direction of the current of injury. In the elderly, or in certain medical conditions, it has been shown that this natural current is much lower than in healthy young adults. And interestingly, experimental studies have demonstrated that the lower the current of injury, the slower the rate of healing. Which brings us on to electrical stimulation wound therapy. Application of small microcurrents through the surrounding skin and into the wound bed can kickstart the bioelectric signaling that directs the wound healing process. Microcurrent devices are thought to do this by boosting a patient's current of injury back up to more normal levels. Heal is a novel, simple-to-use device that applies an automated 12-day program of microcurrent electrical stimulation into the wound and is indicated for the treatment of hard-to-heal and painful wounds. We know that this electrical stimulation therapy works, and it is actually one of the most evidence-based therapy areas in wound management. Key meta-analysis found that wounds treated with microcurrent electrical stimulation devices such as Heal, alongside standard care, reduced significantly more in size, healed significantly faster. Meta-analysis by the Cochrane Group showed that wounds treated with electrical stimulation therapy are almost twice as likely to heal, reducing on average 4.6% faster every week. Aside from stimulating healing, microcurrent electrical stimulation has also been shown to significantly reduce pain throughout and following the 12-day therapy. Heal's effect on pain is related to its ability to dampen down the macrophage-mediated inflammatory processes. You may ask, why haven't these devices been more widely adopted up until now? In the past, electrical stimulation wound therapy devices were expensive, very large, and awkward to use, requiring multiple patient trips to specialist clinics. Also, most of these devices couldn't be used alongside standard care, and this made delivering care tricky. But innovative new devices like Heal make electrical stimulation wound therapy far easier to use in everyday clinical practice. So maybe it's time to consider this evidence-based therapy for your own practice and offer your patients the opportunity to experience the benefits of pain relief and faster wound healing with Heal.